Hello, in this occasion I'm going to speak about the situation of the AIDS in Colombia. First than everything, my name is Daniel Felipe Cuevas. I'm 19 years old, I'm a medicine student and I am in 6th semester. The World Health Organization estimates that the number of patients with AIDS in the world is 34 million, of which 30 million are adults and 4 million are under 15. The World Health Organization estimates that 2 million people die from the disease. Africa remains the continent most affected with 22 million sufferers, and in America it is considered that there are 3 million affected. The Progress Report on the Global AIDS Colombia 2012, published in March of 2012, shows the current status of the disease in the country and compares data from previous studies to map allowing the evolution of the disease. According to the report, the most affected population in Colombia is between 20 and 39 years old, showing a gradual increase in the number of cases reported in recent years. It is noteworthy that this increase is among those over 60 years. Targets in Colombia. The Ministry of Health has included in the mandatory health plan, or PORS, providing condoms to vulnerable people who have AIDS as an additional measure of prevention. One strategy that has been implemented in African countries and has been discussed at several scientific meetings as the 19th International Conference on Retroviruses and Opportunistic Infections held in March 2012 in Seattle, USA, is the use of antiretroviral therapy to prevent transmissions of disease. Until recently, treatment was indicated for patients with certain stages of the disease, but has recently expanded to other indications such as those with tuberculosis or have a steady partner regardless of the immune status of the patient. To achieve the points made by the United Nations Organization in the Millennium Development Goals by 2015, the Colombian government included the fight against AIDS in the document of the National Economic and Social Policy. The government aims to achieve a reduction of at least 1% in the prevalence of infection and people between 19 and 49 years and reduce to less than 2% of cases is caused by mother-to-child transmission, estimated in 2008 were 6%. Also aims to achieve increased treatment coverage, currently considered to be 71% and is planned to reach 86% in 2015. The strategies implemented by the ministry included direct work with vulnerable populations, studies of knowledge, attitudes and practices, strengthening the surveillance system, and measures to reduce perinatal transmission. The Health Ministry emphasizes that currently in Colombia, the diagnostic process, counseling before and after testing, the provision of treatment and follow infected patients is covered, but in the post.